So I am here this morning. This has been long in the planning with an amazing lady that I met last year through my connection with the Root Brands. But I've got Caroline Mansfield here, and Caroline is the most amazing naturopath. I'm going to let her introduce herself in a moment. But I've been following Caroline's work for a while. And Caroline, I must say, you blow me away because one, you really are a perfect example of practicing what you preach and putting all these things into the into perspective in a very good way that people from all disciplines can understand. But the quality of your work is so brilliant, and you've got so much integrity with the way you work. So I'm so grateful for you being here with us today and to sharing your wisdom with our audience. Thank you, Caroline.
Oh, thank you very much for that lovely introduction.
I know, and when you meet Caroline in person, Caroline, you're one of these people where your energy field is just beautiful and glows, and this is really important because when you're working with any professional, it's really important that they're actually walking the talk, in my opinion. So could you just explain to people what you do sort of professionally and how you've got into really being passionate about what we're going to be talking about today, which is all about solutions for safely detoxing our bodies from lots of interventions that we're going to call.
Oh, wow. I don't know where to start. Okay, so, I mean, I've been a naturopath now for 22 years, and I've been doing live blood analysis for about the same amount of time. And I think it's just been such a journey, working with people for all those years. And obviously, as a naturopath, we look at nutrition, diet, lifestyle, and we look at the emotional side of people as well to see how certain triggers can affect their health. So we look at the whole person. And I absolutely love what I do, and I just have done. And I think with the last couple of years, with what's been happening in the world, my work has has taken a new direction, which has involved a lot of microscope work for companies as well. So we're looking at how products affect our blood, and some good and not so, some not so great. So which I'm going to be explaining today and showing you visually. And what got me into naturopathy in the first place was I got quite sick in the 80s, and I was living that lifestyle, working and playing hard, working in the city, which was far removed from my roots of New Zealand, being brought up on the beach. And it wasn't until I went back to New Zealand, I got myself well with the top naturopath in New Zealand, and he looked at my blood. And within 6 weeks, I was back to normal. And I thought, wow, this is what I want to do. So I gave up sales and marketing job, and I studied naturopathy, and I've never looked back.
I just absolutely love that. And very similar, I'm not going to bore people with my story, but I do sort of almost the equivalent. I don't do the blood analysis, which is fascinating, and I've had mine done with Caroline. You're going to see that in the presentation. But I work with animals and their humans to do solutions to all these things. And what you're going to find with today's talk, people, is we are going to show you some evidence of some of the challenges we're all in under today. And we're being very careful with our language, and you all know why. We have to be very careful and use some code words. But Caroline and I are very much about solutions. We know we've both been working in this field long enough to know whatever your situation, there's a lot you can do about it. So we really want you to take this presentation, which I can't wait to start with that in mind, because if you don't know what the problems are you're being faced with, it's often quite difficult, isn't it, Caroline, for people to know what corrective action to take.
Yeah, 100%. And I think also if the body is given the correct nutritional tools, the body will do it. It's not even like necessarily you have to know exactly what product, because right now there are some amazing products out there that will give the tools to the cells, and it will just do it for you. So this is something else we can talk about today.
Brilliant. Well, Caroline has just put a lot of work into a presentation that she's going to share with us, and we're really appreciative of this. So I'll let you start with the presentation whilst I take a swig of my structured water. So.
Wonderful, good stuff.
Yeah.
Just share the screen. Can you see that okay?
It's just coming up with a bit of delay. Yes, that's beautiful.
Okay, so I'm obviously going to read a medical disclaimer before we start. So let's put my glasses on. Okay, so healthcare in the 21st century is almost completely controlled by vested interests, which claim that their system, known as modern medicine, is the only genuine form of healthcare, and that all other forms are to be regarded as pseudo and quackery. The consequence of this control is that I must advise you that the information provided is for educational purposes only and is not intended as a substitute for medical advice of a physician or other qualified healthcare professional. We do not aim to diagnose, treat, cure, or prevent any disease or illness. You should always consult your doctor or other healthcare professional for medical advice or information about diagnoses and treatment. The information provided has not been evaluated by the Food and Drug Administration or any other medical body. Okay, so we can move past that.
Disclaimer I've seen. And just before we go any further, Caroline, we've got a few internet issues, so don't worry if we lose some stuff. You know, if we have a few pauses, it doesn't matter.
Okay.
Beautiful. Right. Oh, love these pictures.
Okay, wonderful. I mean, today's topic is really about looking under the microscope, because I get to see the hidden world that a lot of people don't see. So we may be told to take certain nutrients and do certain things, but I get to see the consequence of this under the microscope. So I think it just takes it one step further, so people can understand that, you know, if we're doing the work like this, then they'll probably be more inclined to maybe take that supplement or make that lifestyle change. And this is what I really wanted to show people today. So I just want to kick off with, some people have probably already seen parts of this presentation elsewhere, but obviously a lot of your viewers may not have done, Catherine. So I'm just going to recap over this antibiotic capsule experiment that I did.
Brilliant.
So when we're talking about being discerning about what we put in our body, I saw online that somebody said that the outside of a antibiotic capsule was magnetic. And that sort of piqued my interest. So this particular antibiotic is fluoxetine, and I actually had some in a medical cabinet that was from 2013. So I managed to replicate the study. I opened up this capsule, and this is the antibiotic powder. And I put the magnet up to the black side of the capsule, and boom, you can see that the capsule latched onto the magnet. And if you look in the ingredients of the antibiotic capsule, it doesn't say anything about any magnetized particles. So I was very intrigued, and the experiment someone had done online was they dissolved the capsule in some water, which I did into some distilled water, and they put the magnet up to the glass, and they were able to see these little black particles appear. They were magnetized, and they had quite a pull to the magnet. So I did the same. So I dissolved the capsule, and you can see that once it's dissolved in this distilled water, it completely disappears. You would think it's, you know, it's just opaque water, there's nothing there. But the minute you put a magnet up to the side of the glass, then all these little black particles appeared.
Wow.
This is it slightly up close. So at that point, you know, lucky me, I've got a microscope. I was intrigued to put this substance under the microscope to take a look at maybe, you know, what this is, what we will find. And you can see they come together in a group, but there's little separate particles. So the only way to actually get this substance out of the water, because the minute you try and get it out with a pipette, it disappears. So I had to literally get this black substance onto the, you know, put the magnet inside the glass, and this sort of black goo jumped up onto it. And then I had a little trouble at getting that goo off the magnet onto the slide, which I did, and I added some of the opaque water onto it just so we can have a bit of movement under the slides, to see what it was going to do. And the first picture that came up, which was quite incredible really, was this.
Oh,
now, yeah, it was like an alien face, and it just completely shocked me as soon as I was expecting to, I don't know what I was expecting to see, but that was the first thing that showed itself to me. And I always say that anything that's you know, benevolent always looks so pretty under the microscope. Anything malevolent or coming from pharma doesn't, and which I'll come on to show you a little bit later. So I kind of wasn't, you know, shocked, but not surprised. And there was another substance. I sort of zoomed out, and then I found these little particles. I'm not playing the videos because when I show the videos on these type of talks, things start to freeze. So, yeah. But these little particles were moved. So I'd put the magnet above the slide, which is under the microscope, and I'd go out about 8 inches, and these particles would be very, you know, attracted to the magnet still, and they would move. And you think about how highly magnetized these tiny little particles are that are going inside your body, that a magnet 8 inches away is still affecting it. And that kind of blew my mind as well. So when I did some research into what these particles are, we call it here iron oxides, magnetized nanoparticles. In pharmaceutical companies, they put these iron oxide magnetized nanoparticles into product because they say it drives product into cell better. This is what they say. But if you look at this, tons of research and lots of papers on PubMed, for example, that say that iron oxide magnetized nanoparticles actually coagulate blood, and they have a lot of issues around them. So they're not great for the blood circulation or for your health really going forward. And then there was another, so we had these iron oxide magnetized nanoparticles, and then when I zoomed out, there's also another substance that looked like this. Now this is a little video, and maybe we'll just try and play it, just so you can see. So when I'm running the magnet above the slide, it's moving like this. Can you see that?
It is, but the connection's breaking, but I can see it moving. Wow, that's brilliant photography. That's brilliant work under the microscope, Caroline.
This is 1,600 times magnification. So I was like, right, I'm going to get you critters and look at you right up close. So this is the area that we saw the this picture in, right? So I've gone into this area, and then this is what I've seen up close. So and when I did my research on what this could possibly be, then I was looking at graphene, and this is what graphene looks like when you look online and look at pictures, same magnification, just slightly more intense actually, magnification. So during this time, I've been very, very lucky to be connected up with a group of doctors and scientists around the world. And especially there's a doctor called Dr. Felipe van Welbergen. Now, he was the first doctor to discover graphene in the interventions that have been going around when he looked at a vial under the microscope. And he was the one who passed his information to Pablo Campra from La Quinta Columna, and they're the ones who have been showing the world what's inside these interventions, which is a lot of heavy metals and graphene. So I reached out to him and said, look, this is what I've found under the microscope. And he confirmed that, yes, that is graphene oxide. So we're looking at, you know, when we're talking about what's going on in the world right now, it's not just what's in the interventions, but it's in other things as well. Yes. And I don't want to scare everybody, because we're going to talk about solutions today, because there are plenty of solutions to try and get all this stuff out of our bodies, because it's in the air, land, and sea. And we are ingesting it in all different ways. So, and I also just want to put a prerequisite here. I'm not telling people not to take antibiotics, because that has come up when I've done other talks. I'm saying, obviously, if you've got a life-threatening infection, you need to take antibiotics if you're getting to that point where your body's not able to do that for you. So I'm not saying don't take antibiotics, because there are solutions that if we do find these substances in us, then we can get them out of us. Okay.
Absolutely. And I just want to say to people, like, just to reiterate that fact, certainly the way I work is you go for the least invasive intervention that's got the least side effects associated with it if you want to bring your body back into balance. But of course, there's times where we need to go up a scale and use things like antibiotics, and that's absolutely suitable. But when you're on with this information, you can then mitigate any possible side effects that might be. And people have been known, some, you know, antibiotics can obviously be life-saving, but equally they can massively affect your microbiome. So I think the general consciousness is aware that sometimes when we take medication, we need to then put our body back into balance afterwards.
Yeah, very well said, Catherine. It's exactly that. You know, sometimes we do need some powerful, because they are powerful, these medications,
Yes.
intervention, and they do have negative effects on our cells and our balance, and we need to rebalance afterwards. So there is a place for medicine, but just not for everyday life. So I think it's more for emergencies, and, you know, which is great. But I just want to say also, because we're talking about, you know, sometimes we think we're okay, great, I'm going to take these nutrients and supplements and, you know, I'm doing really good for myself. But you need to really be discerning in this world as well, because there are nutraceutical companies out there that have been bought out by Big Pharma. And for example, I just want to show you this as well. So this is similar type of substance that somebody found in a vitamin D capsule. I saw online that the outside of the capsule was magnetic. So this particular product came from Australia. So I ordered it, and it took 3 weeks to arrive. And I thought, right, I'm going to replicate this study as well. So I took out the vitamin D liquid from inside the capsule. You can see the little bubbles, little sort of orange bubbles at the back. That's actually part of D, and I found also that this capsule was magnetic, and if you look at the ingredients on the box, it doesn't say anything about magnetic nanoparticles inside the product. And you know, they shouldn't be there, because when you're mixing vitamin D with iron as well, it's not a great mix. If these are iron oxide magnetized nanoparticles, these I haven't discovered exactly what they are. But this is from a 2022 product, and I just feel it's a slight upgrade on what I was looking at from the 2013 product. Because these, let me just, I'll try and play the video, and you can see how they move with the magnet. I did the same process, and they're moving around like almost doing a dance. It was very strange.
Wow.
So I was playing around with these magnetic particles for a while, and I left them on the slide. And when I went back to the slide, they'd all disappeared. And I thought, where have you all gone? And then I realized they all clumped together down one end of the slide. They're all very highly attracted to each other. So again, you know, we know that these particles, iron oxide or any heavy metals, they're positively charged, and they're going to be affecting the blood flow, because I'll go on to explain why the blood needs to have a negative charge on the outside of the cell for it to flow correctly. So they're going to be changing up that disease potential of our blood. So it's not a good thing to be having. And you know, if you look at you've got to look at who's behind the nutritional products that you're taking, who the formulators of the company are, what their ethics are, you know, where they bottle their products, where they package their products, everything, to really get a really, you know, true healthy product. Because you know, as I said, there's a lot of nutritional companies being bought up by pharma right now, and we don't know exactly what they're doing to products. I also want to say, because when I was talking about the iron oxide magnetized nanoparticles, another question that came up was, you can't see nano under the microscope, definitely not under a dark field microscope, because we go down to about 0 microns in diameter, and then we can't see. But and then below that, we start to get the nanometers, and it counts from 0 back, you know, up. So what happens is, when these molecules all clump together, then we can see them, then they become nanometers. So I just want to clarify that as well, because these are all little particles all clumped together, and then they clump together further after that. So
and can I just say, Caroline, for the listeners' benefit, I know you probably know this, listeners, anyway, but when we come on to look at the blood and how it's meant to look and flow and how it doesn't when certain interventions, toxins, etc., are introduced, which Caroline has already said, and I will back up from my experience, because I used to have my own herb shop and products, and the only reason I set that up was because when I was working with my clients and my own humans and animals, I was so horrified by the quality of the products on the market. You know, you think you can go and get some of these natural products and there will be much for muchness, but they are absolutely not. So discernment and doing your research, who and where you're buying from, is key.
Yeah, it's so true right now. And it's just right now, this time on earth, 2023, even more so, it just seems. So it's, you know, really important. So when we're talking about, you know, what the toxicities in the world, I think we're going to be focusing on the heavy metals right now, because they're in everything. You know, we've got, you know, the mercury from amalgam fillings, which we all know, arsenic, aluminium, which is in everything. If you're using tin foil in your cooking, please stop. Use unbleached baking paper, which works just as well. There's little hacks that you can be doing in your lifestyle to try and reduce the toxic load. But the trouble is that these heavy metals, they hide in our body and they go to receptor sites where minerals should be. And this is why they can affect certain organs in the system. So, and also they hide in our fat cells as well. So a lot of people having trouble losing weight can be quite toxic, because they're holding on to a lot of toxins in that fat, and it's not possibly your fault. Perhaps you just need to do like a detox of toxins, and then you'll end up shifting your weight a lot easier. I found that with a lot of clients as well. So let's go on to some solutions. So there's a product I've been working with called Clean Slate, which is a powerful zeolite product. Zeolites go around the body cleaning heavy metals from the cells. And we've known this for many, many, many years. And there are many zeolite products out there, but the beauty of Clean Slate is that it's produced by a company whose formulator used to work in pharmaceuticals, and now she's jumped to nutraceuticals. So she knows how to get product into cell, which is what we were discussing earlier, but in the correct way. So the way she's developed her zeolite product is that it's through her proprietary blend. She's been able to get that zeolite into cell, because a lot of the time it goes around just cleaning up tissue. But her product actually gets into the cell, picks out heavy metals and takes them away. And it's such an easy way to get heavy metals out of your body, because as a naturopath over the years, if somebody's tested positive for heavy metals, we would put them on a protocol which is called DMSA protocol. But the DMSA actually pulls out minerals, and it's not guaranteed that, you know, as well as heavy metals, but it's not guaranteed it's going to be pulled out the body. Those heavy metals could dislodge somewhere else if you're not adding in chelating agents. So the whole process could take about 2 to 3 months, and the client can become quite depleted if they're not re-inoculating with minerals and they're not using the chelating agents. So it's quite a palaver, really. But with Clean Slate, I've done my own tests with it. So clients who've tested positive for heavy metals, I just put them on the Clean Slate, and they just take 5 to 10 drops a day, and that's it, because the Clean Slate also has the minerals in it. So when it's displacing or removing these heavy metals, the minerals are being replaced as well, because that's getting into cell as well. So it's just a beautiful product and so, so easy to take. And then retesting my clients again, sort of 6 to 8 weeks later, the heavy metal load is coming down. So for me, I can vouch for this product, that it works to bring out these heavy metals, which are affecting, all of us basically. And with the Clean Slate, so I've looked at the Clean Slate under the microscope as well. And this is Clean Slate at about 400 times magnification. We want to see different sized crystals. These are the zeolite crystals, which I'm going to show you even up close, further up close in a moment. But the interesting thing was with this product, when I left the Clean Slate on the slide for about 3 hours, and I went back to it, I noticed that all these lines had appeared. And I thought that was very unusual. And not only lines, I think down here, I haven't got the harmonics, there was some harmonics as well. But this is just up close further. You can see that all the crystals started to line up on these lines. So it's almost like it had an intelligence of itself. And this is up closer still. And the way that zeolites work, they have a very powerful negative charge on the outside of the crystal. And as I said, all heavy metals have a powerful positive charge. So this is how the zeolites go around picking out the heavy metals. They attract the positively charged particles. And here is just another image of, look, you can see that border around the crystal, which is like that powerful negative energy. So I just wanted to share that with you. And it's almost like this beautiful Saint Germain hue. I'd never seen anything like this under the microscope. So, you know, it's just amazing to think that when you take clean slate, this is what's in you, what goes inside you, and helps clean up. And look at that picture compared to that pharmaceutical picture that we saw in the antibiotics. So I just want to say, when we look at something that's good for us, I see it under the microscope. So seeing is really believing.
Beautiful. Look at that energy charge around it. It's absolutely amazing.
I know. It almost looks like an angel.
Yes.
Yeah. This was another zeolite. This is the largest zeolite crystal that I found. I was like, wow, this is beautiful. And when I went in for a closer look, you can see, I don't know if anyone can see the top part, but anyway, it looks like Starship Enterprise.
It does. It does.
It's like the microcosm is the same as the macrocosm. You know, when you go in, it's the same thing. It's so interesting. Anything at this sort of you know, quantum, we go to quantum. Anything at quantum has its own intelligence. So when I was at the quantum level, so when I went back to the root brand, these images went back to the formulator, Dr. Christina Rahm, and she said she wasn't surprised because the way she works with her proprietary blend, she does things like fracking, harmonics, frequency. So, and we're going back to that quantum level, that this product probably has an intelligence and knows kind of how to line up and how to work for our body. A lot of people don't really understand that, but, you know, it's like Dr. Bruce Lipton says that, you know, a particle is a spinning vortex of energy. And that energy has a frequency, and that frequency has a light, and that light has a color. And this is the way they're able to find out what stars are made of, based on, you know, that knowledge itself. So, and when we apply that to the microcosm, it's the same thing. And I know it's hard for a lot of people to grasp, you know, for myself as well, but there is an energy, you know, at play here, and I see it under the microscope. So when I was doing the experiment with the antibiotic, I thought, great, now I've got a medium in which to put clean slate to the test another way. So I dissolved another capsule, a half capsule, and I put clean slate in with the water this time. And I left it for 48 hours. And when I went back to it, those magnetized particles, the magnetism had completely, you know, virtually dropped. So they weren't coming up to the magnet. So the clean slate had neutralized the positive charge of those particles. So I thought, wow, imagine this in your body, what it would be doing, be helping to pull it out, you know, through the kidneys and out. This is the mechanism of clean slate or zeolites through the urine. And I put that solution under the microscope with the clean slate in with the nanoparticles, and I wanted to find one of the crystals latched onto one of these iron oxide magnetized nanoparticles, which I did, and this is the picture of that. So you can see the Saint Germain hue of the crystal, and you can see the iron oxide magnetized nanoparticle latched on there, right? So I was like, wow, this is brilliant. I've captured it.
That picture really reminds me, you know, in elementary biology lessons where you learn about the macrophage part of the immune system eating the nasties. It really looks like that, doesn't it? It's like you're giving your immune system this massive extra boost.
It is. It's like, yeah, the monocytes that come along and they're like the Pac-Man. They clean up the body basically. So, and I get to see that as well when I'm looking at live blood under the microscope, and also the neutrophils with the phagocytosis, and they come along and they engulf with their cytoplasm any bacteria. You know, they chase it around and they engulf it. You're like, wow, we don't realize what's going on in our body. And you're quite right. It just goes back to school biology. We have a few lessons in that, and it sticks with us, doesn't it?
It does. It really stuck with me, and it's that image all the time, and you can see that in action there. Beautiful.
Yeah, so true. So yeah, that was just amazing. So when just go on to the blood for a bit. So when we're looking at blood, red blood cells particularly, we want them to be roughly the same shape and size. We want them to be lovely and round. We want them to have a beautiful membrane edge, because the membrane is really important for transporting oxygen and nutrients and taking away waste products. You know, it has a function. So we need it to be healthy for us. And this is kind of a good picture of healthy blood. It's my blood actually. But yeah, this is how our blood should look. And when we're talking about the interventions that people have had, I had a client come to me after he'd had a shot, and his upper arm was very swollen, very red, and he was feeling lousy. And that's obviously why he came to me. So I said to him, do you mind if I just take a sample from your arm? Because I'd love to see what your red blood cells are doing. So I took a sample from his arm, and that's what we saw. So basically, there's a toxic soup going on there because he's got inflammation, which is going to affect the red blood cells. So you can see that those membrane edges are now puckering. They're being affected by the toxicity. Red blood cells' job is to deliver oxygen and nutrients to tissue and take away waste products. So they're not going to be working efficiently for you. And it's you know, he was having headaches, and he just felt very lousy. So
when, for people looking at that image, if you imagine that you've got an apple in your kitchen and it's quite old, so it's starting to really shrivel up, the skin's starting to shrivel up, and so the whole thing is dehydrated. And when that membrane shrivels up like that, the receptors can't work to get the waste products out and the nutrients in, can they?
No, they can't. And you know, it was just a very, very sad picture really, because you know, his body is not going to be working efficiently for him. So I took a peripheral blood sample. That was a great analogy, by the way. I took a peripheral blood sample as well, and this was his blood at the periphery. Sorry, here we go. So you can see the membranes are still affected. It takes 1 minute for a red blood cell to travel around the body. So to just to say, oh, it's just inflamed at that site, it's not true. The blood's circulating. So, you know, his whole body is being affected by what was you know, put into his arm, you know, more or less straight away.
And they're all together.
Obviously, I've had a lot of.
Sorry, you can see the difference between your cells and this one. You can see in this sample here, the red blood cells are all clumping together.
Yeah, they start to all clump together because, good point, because the outside of the red blood cell holds a net negative charge. And this is what we call the colloidal solution of the blood. Basically, they have a net negative charge, so the cells don't clump together. They need to be free flowing so they can go, you know, through microcapillary. A red blood cell is 7 to 8 microns in diameter. A capillary is 3 to 4. So they have to be really pliable, really flexible, not you know, stuck to each other. So they can go through literally one by one in some places in our body to get to where they need to get to. So yeah, good point. And when the outside of the membrane starts to get sick, they lose that net negative charge and they will start clumping in on each other. And then when that happens as well, signals are given out by the red blood cells, and then other things start to happen that makes the blood stickier still. So it becomes like a cascade. And I've looked at quite a few samples of people who've had the intervention. And just to give you an example, this is like typical. This is what we call rouleau, like stacking together of the cells. And a lot of people, after having the shot. I mean, there's all different, obviously, symptoms from different people. But most of the time, there's a lot of brain fog, a lot of headaches, a lot of tiredness. They just don't feel themselves. And that's because, as you can see, the blood's not going to be doing its job as efficiently as it should. And this is just one area of what's going on, basically. And this is another client. And as I said, you know, if we look at the plasma, which should be the clear liquid in the back, you know, behind the red blood cells, in this client, it's not clear. And we've got what we've called fibrinogen. So when the liver is stressed, when there's infection or inflammation, the liver will give out what's called acute phase proteins. And these can show up in the blood as fibrinogen. And also, if we were to do a standard blood test, that would be your C-reactive protein. And the erythrocytes, the red blood cells sticking together, that would be your ESR test, your erythrocyte sedimentation rate, which will show how quickly the blood's falling in the test tube, which shows that you've got an element of inflammation in your body. So what, you know, compared to the paper blood test or what they do in the test tube, we see it in live blood analysis under the microscope. So in real time, we're seeing this erythrocyte sedimentation rate, you know, high. We're seeing C-reactive protein. And also what happens is, you can see here, there's like a clumping of platelets. So that's another mechanism that happens to protect the body, basically. So then we start to have erythrocyte aggregation. We have the fibrinogen, sort of like, and the platelet budding, so like microclotting starting to happen. And what we do is we grade each one of these conditions, so between 1 and 5. And you know, if we've got 5 for each, then we're heading towards a thrombotic you know, episode, basically. So it's really important to, you know, to know that these things are affecting our bodies. And if you are having symptoms, having had it, then I want to offer you solutions, you know, as we go further on in the talk, because there are things that you can do to help clean up your blood. And this is another client. Again, you can see probably a bit more erythrocyte aggregation, clumping of the blood. Yeah, have you got any questions there, Catherine?
I just am so appreciative of, I mean, I'm a biologist, so this is just heaven for me. And what I love, Caroline, and this is why I really want everyone to see your work, who the people that haven't been exposed to it yet, is there's a lot of fear mongering out there at the moment. And there's a lot of sort of what I would call, you know, Chinese whispers. A little bit of knowledge then gets passed on and exaggerated. And what you do with your work is you really, you know, examine everything in such a level of detail, you know, microscopic level of detail, so that you can really see what is happening. And most importantly, that these solutions really are working, because I've got no problem with the placebo effect. I mean, fantastic, you know, let's all get some placebo effect into us. But equally, knowing that when you have got these health challenges, and we will all be faced with them, not just from the intervention, as you've shown, we're all bombarded, and our animals, with heavy metals, pollutants, stresses. We're going to be talking in a different talk on EMF, etc. But the great thing is when you understand that, then you can take this corrective action, and then once you've got your body back in balance, preventative, you know, action to stop these problems occurring. So I'm so appreciative of seeing these pictures. You know, they really do sum up what's happening brilliantly.
Yeah, I think a lot of people always ask me when they know that I do live blood analysis, their first question is, oh, have you looked at the blood of? Yes. I'm like, well, yes. But I also want to say that, you know, a very high percentage of people's blood is coagulated like this after having the intervention. But there are occasionally a few people I look at and it's fine.
Yeah.
So we know that there's different batches, you know, that have been rolled out. So, you know, I just want to highlight that as well. I don't want to be scaring people in any way. And also just want to say, when we look at this rouleau, for example, you know, this is someone who'd taken the intervention, but also your blood can look like this, which we're going to come on to with another talk. If you sit in front of a router, yes, or if you're on your phone for 20 minutes, it can make your blood become quite rouleaued. I've witnessed this, and coagulated. So there's other things that we can be doing to help disperse that as well. It's really looking at the root cause as to what's causing this rouleau. You can become very rouleaued if you're 100% dehydrated, for example. Blood's going to do this. So that's why I always ask people when they come for live blood analysis to make sure they're hydrated, have a light lunch. We don't want to see too much fat in the plasma so we can't read it, and to not be on any devices for an hour before as well. Because otherwise it can potentially affect the sample.
Yeah.
Yeah, so, I mean, we want to be talking about solutions, and with the Root brand, for example, the reason I love this company, as I've explained, is because of the ethos behind the company and, you know, what they stand for right now, and the way that they source their products, you know, the ingredients for their products. They're very, very discerning, very careful that they get only the best for their products. And they have the International Science Nutrition Society that has been set up, and there's you know, hundreds of doctors around the world that have been using particularly the Trinity, which is the clean slate we've talked about, zero in and restore, those three together. So they've been able to assess through various clinical studies with clients, especially top athletes, that who had to have the intervention and then were unable to work afterwards because they were so affected by it. After 3 months of taking the Trinity, they've done before and after blood tests as well, showing that the pro-BNP marker, which is the inflammation of the heart, the C-reactive protein we've talked about, the erythrocyte sedimentation rate, and also the D-dimer, which is the microclotting which happens, which is pretty prevalent. All these markers come right down after taking the Trinity for 3 months, and then these athletes have been able to go back to training again and feel normal. So with these products, it's just so important to know that there are solutions out there. And if you're feeling particularly bad after having this intervention, then I would say the first port of call would be to try the Root brand Trinity for that reason, because of all the clinical studies that have been done, you know, based on the intervention itself, right? The Root brand also do mitochondria defense. And I think this is a very important one as well, because the mitochondria, everyone's talking about the DNA damage from the interventions. And we need to be protecting our DNA. And the mitochondria defense shield actually protects our DNA as well. The ingredients inside the mitochondria defense has a molecule called NAD. And NAD is like the helper molecule that goes around helping to repair the body. And as we get older, this molecule just drops out. So the older we are, the less NAD we have. So this is one of just, there's a few ingredients in this product. I don't need to go into it in great detail because Dr. Christina Ram has done an amazing video on that. I don't know, you might want to link that.
I will. I'll link that below, everyone.
She does a deep dive into the mitochondria defense shield, but basically this goes, it's protecting the DNA. So, and helping to heal the DNA. So this is like an added on to, I would say, the Trinity, to really looking at, you know, all areas of bringing down the inflammation, getting rid of the toxicity, and also protecting the DNA. Because if we look at the NAD, and NAD has, you know, it helps the body in a multitude of different ways, but particularly, you know, for me, I think it very, very important is that DNA protection. And also for longevity, it helps to reduce it helps to keep the telomeres long. You know, we don't want those cutting down and reducing, because that's what causes cell death. So it has a number of benefits, as you can see. But NAD is a really important molecule to be boosting in your body for a number of different reasons. So yeah, that's another solution. Also, looking at your air around you. So we have these sort of, especially if there's a lot of Wi-Fi, we have charged molecules in our air. And the Wi-Fi allows the child, these molecules like dust particles, instead of falling to the floor, they'll be floating around more. So we tend to breathe them in. And this can also affect our lungs and our health going forward. And so the air around us is really, really important to be cleaned up. So Root brand also have these air filters, and there's one that you can put around your neck. So if you're traveling, because you can have the home air filters where it helps to put these negative ions out into the room. So these particles that are floating around because of the Wi-Fi, the static electricity, fall to the floor. So this is how it cleans up the air. But with the portable one that goes around your neck, it's the opposite. It gives out positive ions just so it pushes these particles away from you. So what that's doing is that if you're traveling around, because you can keep your air at home clean, but what happens if you're at an airport or you're on an airplane, or you're just somewhere where you can't be monitoring your air around you and someone else is doing that for you, like in an aircraft, for example, then you're just going to be breathing in, whatever organophosphates, whatever fuel fumes coming into the aircraft, whatever particles. So what this does is it charges up. It gives you, I think it's 28 hours of charge. So great for long haul flights. You put that around you, basically it's just pushing away any pollution from your body. And also it's giving out a little bit of ozone. So it's actually just really beneficial if you're looking at really protecting yourself. This is another way to do that. These products that Root sell. Have you tried these products yourself?
I've got mine on back order because they've been so popular. They've been out of stock for a while, so I'm just waiting for them to come back in stock. I ordered them quite a while ago, so I need to chase up on that when they're going to be back in stock. Yeah.
Wonderful. I mean, I think it's just such an important thing because we're looking at, it's not only what we put in our body, but it's also what we breathe in.
Absolutely.
So another way, without sort of going too crazy, like you need to protect yourself in so many different ways. But definitely, I think for air travel and going through airports and, it's very, very important.
Absolutely.
Yeah. And what else have we got? The other thing that's another product which I've looked at under the microscope and which I've tried myself is something called redox signaling molecules. And online, there's a really good video. You've probably got that video, Christine, because I know that, sorry, Catherine, because I know that you sell it as well.
I love it. I love both the Roots and the Asea. They're just foundational for me. Yeah.
Yeah. And basically, it's like our cells, we're looking at the red blood cell. I mean, they are basically just like a salty solutions or saline stack with what we call organelles inside, like they're micro organs. So we think about our body and we have the liver and the kidneys, etc., and the heart. Well, in our cells, we have organelles, like tiny organs, like the mitochondria, for example. And the mitochondria produce what's called these redox signaling molecules, which go out and they basically heal the body. They find anything that's not working correctly in the body and they heal it. And as a child, we produce so many of these redox signaling molecules just so easily, in abundance, because everything's working so efficiently. And this is why when kids fall over, they cut themselves, they bruise themselves, it just heals very, very quickly. But the older we get, again, a bit like our reducing levels of NAD, the redox signaling molecules fall out the sky. So with this particular product, this is amazing because it's not actually even like giving your body a molecule where then the body has to produce something to protect itself. It's actually going into your body and it's just working straight away for you as your mitochondria would produce these redox signaling molecules. So I just actually love this product. I looked at this under the microscope as well. This was what the redox signaling molecules look like under the microscope. Yeah, they're really pretty, so you can see them. And yeah, I feel like it's just another way that people can protect themselves going forward, because as the body gets older, the body does age, and we are bombarded more than ever right now with toxicity around us. So it's just another intervention that other people can look at. I don't know if you wanted to just talk more on the redox signaling molecules.
Yeah, I've just been blown away with the results. I mean, I work with a whole range of natural products because different people have different challenges, different animals have different challenges, and we're all drawn to different things as well. But I think the beauty of both of these is, as you said, with the redox signaling molecules, you are literally putting back something that the body makes day in, day out, but less efficiently as our bodies get older or as we get more challenges put upon us. So the thing I love about this is it's absolutely impossible for anyone to be allergic to it or for it to interfere with any other medications you're on, because this is inside all our bodies anyway. They've just discovered an amazing way to stabilize it. So, you know, safety is always first, and a lot of people have that concern about what's going to interact with what, and you can know that you're very, very safe with this.
Yeah, 100%, because it's just basically made up of salt and water, basically, you know, oxygen, the molecules of oxygen and the molecules of salt. So no one can be allergic to it. And yeah, it's a very interesting product, and I love it. I actually really love this product a lot. So just another way just to keep our body healthy, and we just need all these tools. As I said, you know, the body will do what it's designed to do if you just give it the correct tools. We were looking at, you know, I was talking about live blood analysis, which is looking at cellular morphology, but I also do dry blood analysis, which is looking at coagulation morphology. And so it's just another test, and it's what people can do if they literally can't come and see me. So I have clients abroad, and they'll send me their dry blood samples, and I can look at their blood, because it'll show, it will tell us a similar picture as live blood analysis, but in a different way. You know, the pictures are slightly different, which I'm going to show you now. But we did your blood, Catherine.
And I was a guinea pig. Yeah.
I was absolutely blown away by your blood, because you sent me your sample, and I was like, I can't actually find anything in your blood. So I thought, oh my gosh, you are doing everything amazing. So it just must be everything that you're taking. And this is what we see when people are really looking after their health. It shows straight away in their blood. So yeah, so we have dry blood analysis, which is coagulation morphology, looking at the pattern that the blood dries. You know, we do eight dots of blood, and then each sort of ring tells us a different story, and there's different layers as well. But if we're looking at dry blood analysis, there's a picture, so you can see that this is how blood should really look. You know, we actually want to see a fibrous network where we can see, like, there's no sort of tight joints as such. And then somebody whose health is compromised, it used to be called the oxidative stress test, and then we just call it dry blood analysis now, but you can see all these gaps. Yeah. And that's pretty, it's showing us that that person is having health challenges, and they will know they're having health challenges at that point. But when I did your blood, Catherine, look at this, just all joined. It's just beautiful, and it's not often that I see that in clients. So it was just really, really amazing to see. So I got on the phone to you. I said, "What are you taking? What do you take?"
Yeah. And I wanted to do, I mean, I would encourage everyone, below the video will be all Caroline's contact details. And this is such a simple test to do. But, you know, the thing is, Caroline and I are so about preventing problems, or if you do realize you have got a challenge, there's coming up with solutions for what you can do about it. So, you know, this is the important thing. It's never too late to make these changes. And I was so pleased, because obviously I do regularly take all my root products, my Asea and my structured water. And, you know, when I sent off my sample to you, Caroline, I was just recovering from a period of not feeling unwell. And I thought, okay, I'll take it now when I'm feeling at my lowest, because obviously I want to see. So I was quite relieved to show that the products and everything are working. And everyone, you can order these even from abroad, these tests, and the details we'll give below the video. And you can always contact me as well to find out how to get those from Caroline. This is so important, because it gives you as an individual a really good bit of information to help you make a decision about if you've got to take any corrective action. So You know, this is when we talk about sovereignty to me and taking back control of your health. Yes, we know we've got all these challenges coming at us, but I don't worry about those anymore, because what my mind goes is, okay, what do I need to do to take one step, keep one step ahead of the game?
Yeah, it's so true. And I think with your blood sample, the only anomaly we saw, which I just haven't put up here, was there was a little bit of lymph congestion.
Yeah.
Just been recovering from whatever it was you had. So that's not surprising anyway. But that was it. You know, everything was perfect. So yeah, well done to you for everything that you're doing. And this is what it is. It's prevention, and just like a drip effect. You know, these things catch up with you. It's a bit like a bad lifestyle. You know, you can do it for so long, and then eventually it bites you. So just doing these things on a daily basis, it makes a huge difference to your cellular health. And I see this all the time. So just to give you some idea of some pictures, as I said, oxidative stress. So we're seeing gaps, which these are called polymerized protein puddles, PPPs, and we don't want to be seeing PPPs at all, because it shows this element of oxidative stress, inflammation, infection. The body's dealing with some challenge. Also, we can see what we call viral spikes. So when someone's dealing with an infection, you can see these little spikes spiking out in the PPPs. So that's an indication that that person, because some people don't know what their underlying health challenge is. So it just gives an insight into actually it is particularly, you know, more viral. So more viral, when I talk about viruses, I'm talking more about the body detoxing, you know, cellular debris, right? Into where the body's just working to get rid of cellular debris, basically. And this is what we call viral spikes. And that will give us symptoms of not feeling so great.
Without saying too much, I would just draw people's attention. I'm sure they haven't missed it with what has been talked about a lot over the last 3 years. And in fact, if you're going to be administering extra spikes into people's bodies, you're clogging up that whole detox pathway massively, in simplistic terms.
Yeah, it's so true, so true. And this actually was from a lady who had the intervention, interestingly enough. Okay. When we can check out toxicity as well in the blood with dry blood analysis. So when we get what we call these salicylic acid or Heinz bodies, if they get quite dark, it's just showing there's an element of toxicity that needs to be removed from the body. What else can we see? We can see heavy metals. So on the outside of the sample, if we get these dark lines, it's an indication of heavy metals. So what I would say is, if this came back with a client, then I would do the standard laboratory test to back that up before we started to go on a heavy metal protocol. Or some people will go, no, I don't want to do that. I can see it. I want to just go straight on a heavy metal protocol. But I actually like to back things up always. And this, for example, is about patterns. So this is in the very center of the sample, one of the layers. We get this picture, the dark, and with these PPP puddles as well. That's a really typical bowel picture. Someone's got issues going on there. So there's all these different pictures that we can look at and evaluate with dry blood analysis.
Amazing.
Yeah. And I think when we talk about our health, and we're talking about down to cellular level, and we're talking about products, and we're talking about quantum, we're talking about, you know, the particle is a spinning vortex of energy. I just want to leave you with the next video, because I was working with another company, is a flower remedy company. Okay, this lady's worked on the bark remedies. I think she was the original lady to bring bark to the UK, you know, to really make it, you know, available to everybody. And she's working on her own flower remedies now. And she asked me to look at one of her products, and under the microscope, which I did. And I was, again, like so startled, because I noticed within this particular product, so she sent it to me. It's a flower remedy that's in a bottle, right? It's bottled, and there's these little molecules in there from the flower remedy. I don't know what these molecules are exactly, but I'm looking at them and reporting back to her. And this particular remedy, the molecules showed intelligence, right? It showed empathy. And I hopefully this will show if I play it. But basically this little molecule here, he was moving, then he stopped. And then this molecule here keeps coming back to check on this molecule. Now this is from a little, you know, a drop of a flower remedy onto a slide. So you can imagine how tiny this whole process is. But I'll try and play the video to you and see if it plays, Catherine. So you can see he's coming to look, seeing it's not moving, and he goes away. So I'll just carry on watching. The molecules are going all over the place. It's not a one steady flow. So he's doing his own thing. He comes again, goes away. And eventually he comes back and kind of circles the molecule. And I was thinking in my head, he's going to bump into him next. And lo and behold, he does this little movement. Boom. It's like he's trying to say, hey, get up, move. And he's like, yeah, I've had enough. And he's gone.
You know what that reminds me of? You know, when like if a bird flies into a window and stunned or something, its friends will come up and try and get it going, getting it out of danger. And there's so much research. In fact, my husband's reading loads of books on this at the moment about we're learning so much now about how plants communicate with each other on so many different levels. And if in a forest, you know, one tree's in distress, the others pick it up and send it nutrients through the rhizomes, probably energetically, that we haven't picked up as well. So it doesn't surprise me that. I mean, I love flower remedies, I love essential oils, I love herbs. So that is beautiful. And look again at the brightness and the life force of that. You know, it reminds me of the clean slate pictures.
Yeah, definitely. It's just and also the swirling pattern in the background. I quite like that particular remedy. That made it itself. You know, it's flowers, and you know, it's just amazing to see this at such a microscopic level, the intelligence there. And I was blown away by that. I was, wow. I've watched that so many times. And then I was trying to pass it on to Dr. Bruce Lipton to say, hey, this is what you talk about. And I've captured it, you know? So yeah. I'm still finding a route to him so he can see this, because it is basically a molecule is a spinning vortex, or particles, a spinning vortex of energy. And that energy has a frequency, and that frequency has a light, you know, that light has a color. It's just amazing. Yeah.
And this all ties in, Caroline. I mean, this all links in together, but I can't remember the name of it. My mind's gone blank. But you know, when they put sand on a platform and play different frequency musics to it and it forms those patterns, this is what that looks like to me.
Yeah, it is. And when you put those frequencies and then you can see the patterns that are made, we realize we understand nothing.
Exactly. Absolutely. And even more beautifully that we don't need to, because nature has all the answers. So well, exactly. We just need to ask nature for the help and know where to look. That's beautiful. I bet she was delighted with those results.
Oh yeah, 100%. I mean, there's lots more to tell with these flower remedies. And she was in a pyramid in Egypt, and she made some energy water from that and asked me to look at this energy water. And the only thing, I was looking and I said, well, there aren't really any molecules to look at because it's basically just water, but there were a few molecules there. And eventually what these molecules showed me was DNA. There's a pattern of DNA. And I was like, whoa, that was just awesome. Like, it produced DNA. If we go back to the history of, you know, the pyramids, etc., it's all about DNA if you go right into it. So, and that was before I realized that. It's just amazing.
It's just amazing. And you know, I was one of these squatty pants. I love school because I just love learning. Didn't like learning what they wanted me to learn, but I was an annoying person that just asked why all the time. Can see, I'm so sorry, teachers. I was but this is so exciting when we see how much we've got to discover. And your disclaimer at the start summed it up beautifully. It's like, yes, okay, we haven't said, but now the world is our oyster and we can rediscover a lot of this ancient mystery, shamanic teachings, put it all together with our knowledge that we've got now. And it's an exciting time for all of us with all these solutions available.
Yeah, it is. And just, leaving on that note, as I've said before, I don't know if a lot of people realize, but our heart emits light. I think it's 20 photons. I think it's 20 photons of light a minute, or a second. Sorry, a second. But we're able to raise that. If we put intention and good thoughts and the correct frequency and energy, everything that we do, that we can raise that up to 100,000 photons of light per second. And this is why, when we see some people have, great energy around them and they attract a lot of people and their messages get out to millions of people, because they're missing that frequency and that light, And then some people, when they're feeling very depressed and low, you can see just through their eyes, their light's gone out. And they need boosting in that way. And by boosting our inner light, that is also helping our health going forward. Our light is like our sword. Our light will help us to navigate what's going on right now. So whether it's meditation, whether it's prayer, however you do it, whether it's walking in nature, whether it's grounding yourself can also help, with the negative ions, putting your feet onto the earth. All these things help, generate the correct frequency within our body to block out all these negative energies and help our body get rid of all this nonsense that's around us, basically, all this pollution and toxins that we're having to deal with right now, and the EMFs, which we're going to talk about in another talk, hopefully.
Absolutely. Absolutely amazing work, Caroline. I absolutely love it. And there are no such things as coincidences. The more we learn about this. And I was just talking yesterday with someone I was speaking to on my channel about the Celestine prophecy. And I've just reread it, and I've read it 3 times now, and I just love it. And every time I get something new, but yes, that is supposedly a fictional book. I'm putting supposedly in both, but all these ancient techniques teach you how to increase your heart energy field. In modern day work, you can go and look at the Heart Math Institute, and they've got loads of ways to not only increase that, but also get your heart, brain, and coherence. So whatever resonates with you, I think that Caroline has shown today, there's so many solutions out there. And for me, knowledge is power. If you know, the more you know what you're dealing with, the more you can prioritize the solutions for you. And it's like this ongoing conversation, do you think, Caroline, with your bodies, in terms of they're giving us clues and symptoms all the time. The important thing is not to panic about it, in my book, but to recognize it, thank them for showing you. And then there's loads of ways people can get help to do something about it. Brilliant presentation. So tell people how they can contact you, Caroline, and what services you can offer them.
Oh, bless you. So, just basically my name, it's carolineMansfield.com. If you go to my website, then you'll find my contact details on there, and you can send me a message through the website or send me a WhatsApp through the website and connect up with me. So I offer naturopathic consultations and live blood analysis, dry blood analysis. It'd be lovely to hear from anybody. If you've got any questions as well, then please feel free to contact me through my website.
Absolutely fantastic. And of course, all Caroline's links will be below. All the links will be below for the products we've discussed. And we'd love to hear what you think about this. And please do share this widely for if you've got people that are concerned from any aspects of their health, not just from the current interventions, from any aspects, because the beauty of this is there's solutions out there for you. And let's all, when we look after and we're feeling vibrant in our physical bodies, everything else goes better for us. So Caroline, you are an absolute star. I loved that. Every time I listen to you, I learn more. Your visual presentations of it all are absolutely brilliant. So thank you so much for putting all the effort you've done. This takes a long while to put presentations like this together. So I really, really appreciate that.
Oh, thank you so much for having me on. It's lovely to be able to share my work and discoveries, you know, it's for everybody. So just so happy that you allowed me on your channel so more people can learn.
And we will be back with an exciting one, so watch this space for that. Take care. Thank you, everyone.